Hello again. Now, Higher Health is urging this year's first-year and returning students to prioritize their health. It's warning historical health challenges such as HIV, substance abuse and mental health issues have been exacerbated by the COVID-19 pandemic. Well, Higher Health, if you're wondering, is an agency of the Higher Education Department. It's focused on student health and well-being, very important at the moment. Let's speak to Higher Health CEO Ramneek Ahluwalia this morning. Ramneek, a very good morning. Thank you so much for your time this morning. And let's consider what's happening at the moment with students and the challenges and the battles and obviously the stress they're feeling over the fees issue. They might just tell us they have more pressing issues rather than their health and well-being or their wellness at the moment. But I would imagine that that is something they would particularly have to take care of right now, considering what they're facing.
Good morning, Uveka. Good morning to everyone. You're absolutely right. In fact, I'm going to start with a very different tone, and I'm going to ask that I advertise a number which is 0800-363636. This is a toll-free Higher Health crisis helpline for mental health and for gender-based violence. 2 o'clock in the morning, 3 o'clock in the morning, mental health is real. COVID has brought this reality. What we're seeing and experiencing has a very direct relation to COVID. These same students are coming from families where their parents have lost jobs. There's bereavement in their families. There is a huge economic loss at this moment for the entire country, including their own families. Their own uncertainties about their own careers, which is absolutely real and true. How will the academic year work this year among the middle of this whole COVID pandemic? When is the third wave going to come and disrupt studies again? So these are all real challenges, and I think mental health needs an absolute priority, along with many other pandemics which are absolutely youth-centered, and this is a very tender age. It's early adulthood, lack of parental control. You're coming into this peer-to-peer influence and unspoken environment, and so these challenges do become very vulnerable to them, very real to them. And I think as much as we're seeing what's happening around us, student health and student well-being remains a priority, because if we lose them at this age, we lose an economy.
And Ramneek, you've mentioned the big ones, you've mentioned the obvious ones right now, things like COVID, the fee stress, what's happening at home as well. Just give us sort of traditionally, when we talk about youth epidemics, what have these students, what's at the base of it all? What have they been dealing with for years now? And then we add, of course, these most recent challenges to that.
Absolutely. I mean, HIV, if you say 8 million South Africans live with HIV, that's a big number. And it's a youth pandemic. The first time new infections come is between the age of 15 and 24. This is where students or young students, which are 18 years, 17 years, form into relationships, sexual relationships. And this can become sometimes very, very sensitive at times. And this can actually, and if we don't promote prevention, if we don't explain prevention, this can lead to a future that can, and it takes so hard for them from their basic education, their studies, their parental support, guardian support into tertiary system. So these skills get disrupted because of pandemic like HIV. TB is massively, and we live in closed rooms in residences, in classroom activities, whether in TVET college in the rural areas or informal settlements. This pandemic is real. We're the third biggest nation of TB pandemic. Again, very correlated with HIV. Unplanned pregnancies. If 1 in 3 girl of our post-school education become pregnant on campus, these are very young girls, 17, 18, 19. First of all, from maternal health perspective, it's not a right to become pregnant at such a young age, but we drop out. These girls eventually drop out from their studies. And it's very difficult to retain them back once they have dropped out due to pregnancies. And by the time they realize, they are either at the stage where we can't do medical abortions, they're at a stage where it's a bit too late, and eventually they don't even have money to do abortion. So it's a very sensitive time of their life. Gender-based violence, as we all know, is very ripe. We're a microcosm of a bigger community, and it becomes pronounced in post-school system. It's peer-to-peer. The drugs and alcohol, if 65% of GBV is preceded by drugs and alcohol, and in our system, 60% of our students abuse alcohol and drugs every month, then there's a direct correlation with drugs and alcohol with all these pandemics.
Very, very scary figures indeed, Ramneek. Very, very worrying as well. But, you know, let's just put it in context of what's happening now in terms of support. If we have, you know, higher education or higher or tertiary institutions and governments saying we just don't have the money to help you out with things like fees, to help you to pay for your accommodation at the moment, there is no money. What support is there in terms of what we're talking about, health and well-being and wellness? You know, are we seeing that also fall by the wayside? Because if there's no money for fees, how do you put money into that? How do you sort of justify that we'll have somewhere for you to come if you're feeling suicidal or you're having some kind of health issue? Is there money? Is there that kind of support on campus? Is there enough support?
I think we first of all, our funding comes predominantly due to youth and to save the youth. And it comes from global partners, comes from World Bank, it comes from many other resources, including the private sector. And I'm very grateful that private sector participates into this, because eventually these skills that we are building is for a longevity of economic sense for the private sector or even the government sector. So I think health will always be a predominance, including COVID-19. If we do not save lives, all these things which we are seeing the real South Africa at this stage will be meaningless if our economy doesn't sustain through our skills longevity. But what I am emphasizing is that young people and young students, and I've advertised a number which I've already done, and I'll reinstate the number as 0800363636, and I'm repeating this is because it's 24 hours, 2 o'clock, 3 o'clock in the mornings when real crises happen. Some worrying data is that 10,000 crises have been averted since August when we launched this line. Yes, it's a worrying number, 10,000 lives, but there are many more that do not know this number, and through you, Uveka, we're trying to advertise.
Okay, well,
when they go back to their campuses, there's orientation, there are campus clinics, there are services, there are education programs, there's prevention packages. They need to enroll into them and look after them. And that's the only hope we have, is to save them.
Okay, Ramneek Ahluwalia, thank you very much for that. Let me just repeat that number. It's 0800 36 36 36, 0800 36 36 36. And as you heard Ramneek say there, that any time of day or night, somebody will be there on the other end to listen to what you're going through.